Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we're announcing 4 new cases of COVID-19, bringing our total to 246. As of this morning, 8 individuals are hospitalized. Of that, 4 are in intensive care. The total number of deaths in Manitoba remains at 4. We are listing 99 individuals as recovered. There are 143 active cases. Public health investigations are continuing to confirm details, and information will be updated on our website as more information is available. Yesterday, 32 tests were completed at Chatham Provincial Lab, bringing the total tests completed to 17,245. These numbers reflect the the decreased demand for testing over the Easter weekend. So again, I'm cautioning Manitobans not to interpret our low numbers to mean that our risk is reduced. We are still early in this outbreak, but these numbers show that our efforts are having some benefit. Our social distancing strategies are showing some effectiveness, in addition to the public health investigations, case identification, contact identification, and follow-up. So these numbers certainly are remaining low, but that could change if we loosen up on our strategies at this point. Flattening this curve, of course, the idea is to limit the amount of cases and the amount of severe cases, but it also gives us time. Also gives us time to continue our preparations in the healthcare system. We're ramping up our ability to test and increasing capacity over time. So the more time that we allow, the more preparations will be in place to handle more cases as they arise. Today I'm extending the current public health orders under the Public Health Act. Non-critical businesses and operations will continue to be suspended until April 28th. We're also continuing to limit public gatherings to no more than 10 people at any indoor or outdoor premises. Restaurant and bars will remain closed with the exception of restaurant takeout or delivery. Critical businesses that do operate must continue to ensure a separation of 2 meters between patrons and their facility. Municipal transit services, taxis, and other private vehicles for hire may continue to operate, but they are required to ensure there's reasonable separation between people in that vehicle. Extending these measures will help us to continue to flatten the curve and decrease the impact of this virus on Manitobans. We continue to remind Manitobans that all non-essential travel should be cancelled or postponed, and the importance of those returning from outside of Manitoba to self-isolate for 14 days. Every Manitoban, regardless of where they live, needs to stay home as much as possible, wash your hands, and only go out for necessities. If you do go out, continue to wash your hands frequently and ensure you keep that social, that physical separation between others while you're out. If you're in locations where that may be difficult, then you can consider using a non-medical mask as well for added protection. And again, these non-medical masks don't protect the person wearing them, it protects the people around them. And so what's vital is to stay home as much as possible to maintain physical distancing if you must go out. This virus is in every health region in the province. There's no area in the province that you should feel safe from this virus. All Manitobans should be practicing these physical distancing strategies at all times. We continue to work on innovative ways to meet the need for personal protective equipment in Manitoba. We're asking Manitoba manufacturers or businesses to rapidly scale up production or retool their manufacturing lines to develop products made in Manitoba. We are asking Manitoba suppliers and distributors with inventory or established channels to provide help in the fight against COVID-19 to step forward to help us. We are asking those who can donate supplies to do so. Visit the information for businesses page at manitoba.ca/COVID-19 if you can help. I want to remind Manitobans to continue to access credible information about COVID-19. Visit our website, manitoba.ca/COVID-19. All of these efforts, including some of the early numbers that we see, are indicative that our efforts are working. Our social distancing strategies are keeping numbers down. We are able to flatten the curve. We need to continue our efforts to keep this progress up. If we lift now, we could see these measures reverse and increasing numbers again. These restrictions will not be in place forever, but if we double our efforts now, we could in the near future be able to relax some of these public health interventions and follow the outbreak as it continues. I want to thank all Manitobans for their assistance, and I'll turn it over to Lanette now.
Thank you. Good afternoon. I'd like to begin today by congratulating everyone who practiced appropriate social distancing strategies during the holiday long weekend. We know that many Manitobans typically set aside this time to meet with large families and attend religious services. And unfortunately, this pandemic has made it impossible for these type of activities to safely occur as originally planned. So it was really encouraging to hear about how people were being creative in finding the connections over the weekend. So we heard about lots of video chats happening with relatives, people leaving food on the doorstep of others who are self-isolating, as well as a lot of waving through windows of patients who are in a hospital or personal care home, just to let them know that you're thinking about them. And rather than attending church, people logged on to websites and watched their services from home. So to be clear, this wasn't the typical Easter or Passover that any of us would have anticipated or preferred, but staying socially distanced now, we are doing our part to flatten the curve so we can celebrate future celebrations together. So thank you all for doing your part, and we truly are all in this together. I wanted to give you just an update on testing sites. So the community testing site in Brandon is moving to a new location tomorrow, and this will allow us to establish another drive-through in the city, which has proven to be popular in other Manitoban communities. So the new location is at the Brandon Town Center off of 8th Street on the P1 level of the parkade out of the old Canadian Blood Services doors. It will open Tuesday afternoon, and the new site's regular hours after tomorrow will be 8 to 4, 7 days a week. And for up-to-date information on community screening at sites throughout the province, go to manitoba.ca/COVID-19. And that's it for me, so we can open up to questions.
From CTV National News, Jill.
Hi, thanks for taking my question. I'm just wondering what the PPE situation is. I know you were sounding a bit alarmed over the weekend. How are things progressing, and what is needed now?
Yeah, so we've been working all weekend on this topic and looking at putting out some guidelines, and implementing those guidelines, making sure that supplies are distributed. Also looking at, we talked about previously, the multi-pronged approach to make sure that we're not relying on one vendor but multiple vendors. We've had tremendous support in terms of donations, lots of creative solutions Manitoba made that we're working towards. So part of it is being creative and making sure that we find every angle to resolve this. I think from my understanding, we are in a better position than we were last week. We still want to replenish our supplies more because there were a few shipments that did not come, or did not come in the volumes we were expecting, but we are anticipating we're going to be okay. We're cautiously optimistic. We still want to look for ways where we can conserve or reuse or reprocess whenever possible. And we'll be working with the regional health authorities to make sure that we can get the supplies distributed to the people who need them.
Thank you.
From the Winnipeg Sun, Scott.
Hi, it's Scott Bullock here from Winnipeg Sun. Question for Dr. Roussin. I guess what went into keeping the current rules in effect and extending those, and why was the decision maybe not to either, well, you already answered why you would relax them, but maybe not, I suppose, tighten them a little bit more.
Yeah, it's a good question, and I think that's certainly not out of the question. So we needed to ensure there wasn't a gap in these orders, and so that's why they're extended today. I am looking at potentially even later this week at certain options to enhance the orders, because like we said, is that this is not the time to lift anything. We can't relax our efforts at this point, and in fact, if we can double our efforts, we may be weeks away from being able to scale back some of these restrictions. But we need to ensure that we keep on top of this now and then follow our numbers closely.
And to follow up, when will you see the, I guess, the effects of the messaging that was brought forth for this past weekend specifically? When will you know kind of if that worked or maybe it didn't?
Yeah, so if there was a lot of community transmission that occurred, we would likely be seeing it anywhere from 7 to 14 days later. And so we'll be looking for those spikes, and that could give us a clue on whether any strategies had worked.
From CBC Radio Canada, Mohammed. CBC Radio Canada, Mohammed.
Hello, sorry, my mic was off. I'm Mohammed from Radio Canada. I have one question. Was there any penalties or arrests made regarding the public health order over the weekend?
Oh, sorry, I didn't catch that.
Was there any penalties or arrests made regarding the public health orders over this weekend?
Oh, right. Yes. So I'm not aware of any fines that were handed out or any certainly any arrests related to anything of that nature. I know they had the city had the community ambassadors out to ensure the measures were being followed, but I'm not haven't been made aware of any fines that were issued.
And I have another question. Are we aware of any outbreaks in long-term care facilities or senior homes?
We don't have any outbreaks at this point. We're obviously putting in a lot of restrictions and a lot of efforts to prevent that from happening. So we monitor those situations quite carefully, but I'm not aware of any outbreaks at this point.
From CBC Manitoba, Bart.
Vicky, the CBC Manitoba. Dr. Roussin, can you please comment on the rapid COVID-19 diagnostic tests approved by Health Canada?
Right, so this there's a couple rapid and point of care or semi point of care tests. So the Spartan Cube and the Gene Expert. So right now in Manitoba we have the Spartan Cube, and we're looking at starting to validate that tomorrow. And so even though it's been approved, we still have to see how it performs based on the PCR at the lab as well. So that work will start tomorrow, and once we're convinced that it's a valid test, then we'll start utilizing that.
And when you say that work will start tomorrow, I mean, how many days, over how many people does that get tested? And if you have it, where would it be, what kinds of communities would it be deployed in? I understand it can't do many a day. Can you just talk about how it will be validated and where it will be deployed if it is valid?
Yeah, so the validating happens as part of a study, so that will happen in the city here at an acute care facility. How long it will take will depend on how many the people they get to see a day to test it on. Where we're looking at using it is in a variety of areas. So one is where a rapid test is valid and will change management. So certainly people being admitted to hospital, it'll be nice to know earlier if they're positive. It might be deployed in areas where they're remote, and being able to test and get a rapid result back would be beneficial. So we're looking at a lot of avenues for that, and it'll depend on how many tests are available, how many units are available, but those are kind of the areas we're looking at implementing them.
Thank you for that.
From CTV Winnipeg, Michelle.
Hi, I was wondering if you could go over again how you determine that somebody is considered recovered, and have we seen anybody in the community who's recovered and again tested positive?
All right, so for recovered, it would be 14 days after the onset of symptoms and being without symptoms. So asymptomatic and 14 days after symptom onset, they would be considered non-infectious and be off of isolation. We have not been aware of any reinfections. So no one who has tested positive had become reinfected here in Manitoba.
And then with the low numbers that we've been having, how are we going to make sure that people stay engaged with the public health orders? It's kind of degenerative to this pattern with you think it's going away.
Right. Yeah. So this is good point, and I think that it's vital. I've said it is that these next couple of weeks are critical in Manitoba's response to this virus. So we've been seeing some low numbers. These are very likely results, in part at least, to our social distancing strategies. So we have to keep this up, or we will see those numbers climb again. This is why that likely sometime this week we'll be enhancing the public health orders to get that message across that although we see some low numbers, we need to double our efforts right now. If we stay to this plan, we continue to see numbers like this, the sooner we'll be able to relax some of our public health strategies. But right now we have to remain focused.
From the Canadian Press, Kelly.
Apologies, my mute button was stuck. You mentioned that in previous press conferences that these efforts and in some sense some social distancing could last throughout the summer. So why not extend the current public health order longer than just the end of this month?
Right, so it's very likely that physical distancing, social distancing strategies are going to be in place for the foreseeable future. Just to what degree will depend on what we see. So certainly the degree of social distancing that we have right now, I don't expect to keep that in place for, until the summer. We're going to have some restriction on group sizes, some changes in how we live day to day. But I do not expect to see the degree of physical distancing strategies that we have right now in place for that many months.
And will you be broadening the range of who can be tested like we're seeing in other regions across the country?
So if we're comparing to most regions, we test a large group of individuals. We're going to continue to broaden that as our capacity widens. But right now we're testing all inpatients with respiratory symptoms, all healthcare workers with respiratory symptoms, all returning travelers with respiratory symptoms, first responders, those in long-term care, those in the north and in remote isolated communities. So we have a very broad testing strategy right now, but we're going to continue to expand that as necessary.
From City News, Stephanie.
Stephanie Lucic from City News. Ms. Siragusa, just wondering if you can give us an update on how much PPE we have, the N95 masks and gloves, how long they will last.
I think as long as we are using them appropriately, I believe we have at least a couple of weeks now, and we have more coming or being made as we speak.
And have any more healthcare workers tested positive for COVID-19?
Yeah, we will give you a more detailed update, I think on Wednesday, but I can tell you right now there's been about 2,500 healthcare workers tested overall, and we haven't seen any more we've seen more testing, but no positive results over the weekend. So we'll give you a bit more of a breakdown later in the week.
From the Winnipeg Free Press, Carol.
Hi, it's Carol Sanders at the Free Press. I have a question about home care. The WHO updated its priority services and visits protocol, and we've heard clients were told over the weekend that some services are going to be canceled, including showering and bathing and laundry service. So my question is this correct? Why is this being done, and how long will it be in effect?
Mm-hmm. So those are part of the ongoing conversations that we're having provincially. Just like we've had to pull back on some of the surgeries and the diagnostic testing, there may be a need to reduce temporarily some of the home care services that are provided, sometimes due to staffing, because we have redirected a lot of staff to different areas now. So those conversations are happening. And I would think it would be very temporary. It's not something that we think would be a long-term thing. And that would be the whole part of this COVID-19 response, is there's going to be times where we have to tighten up and have these restrictions. And then there's going to be other times where we have to provide more. And so as Dr. Roussin said, with social distancing and crowds, the same is true for healthcare services. So my understanding, we do have principles that every region should be following, and it would be on a case-by-case basis and a temporary solution, not long-term.
My follow-up question is questions about testing, and if testing is going to be expanded to more people, what groups are the next in line for testing? What would be the next priority for people to test?
So there's a couple of ways to do that. One is to expand our to critical service providers. So that's another step there. We have first responders now. We could open it up to all what we would describe as the essential workers. The other thing to do is sentinel surveillance, is to set up a certain site that would just test everyone with the respiratory symptoms that are presenting, just to give us an idea of the community-based transmission. So we're looking at both of those, but that's those would be the next steps.
From Global, Marnie.
Good afternoon, Marnie Blunt from Global News. Dr. Roussin, as we mentioned earlier in the press conference, we did see a lot of people trying to do social distancing over Easter this weekend, whether it was standing outside windows or outside balconies. In some cases, they were dropping off packages for family members. Just wondering what your opinion is on that, and if that is a safe alternative.
Yeah, so again, I think that the overall message, if it has to be a black or white message, is to stay home as much as you can. And so that's the message if it has to be clear. If you're going out dropping off a package and leaving, maintaining social distancing, then we're talking about a lower risk type thing. So if that requires you going shopping, an extra trip to the store to pick up something and then deliver it, it's adding risk each time. So the idea is stay home except for essential things, and then Manitobans, you can use some level of judgment based on certain things that you want to do, but the black and white answer is stay home.
Just a follow-up, you touched on relaxing social distancing restrictions in the future. Can you be at all specific on what that would look like in terms of changing restrictions on social distancing and how that would potentially roll out?
Yeah, so that's going to depend a bit on what we see, what our numbers are. We're still working on some modeling information that'll help guide that, but it'll be a very gradual rollback of the restrictions, and that would usually start with a rollback on the restrictions on businesses. And so we would look at that and look to gradually roll things back while very cautiously watching our numbers.
From the Brandon Sun, Drew.
Thank you. This is Drew Mason from the Brandon Sun. Dr. Roussin, just looking online, it looks like there was another unnamed tattoo shop in Brandon that was closed for contravening the March 31st public health order. Could you comment briefly on that, and is there anything the province can do to help get the message home to those types of businesses?
Yeah, I don't have any specifics on that particular site, but yeah, I mean, I think it's it's difficult. There's a lot of businesses that are struggling because of our efforts. We know there's individuals that are struggling. There's individuals who find it difficult not to visit their loved ones in long-term care facilities. This is a difficult time for Manitobans, but we all have to play our role, right? And the more we can stick to that role right now in these upcoming weeks, these critical few weeks, the sooner we can start looking at removing some of these restrictions. But it's important for everyone, and I think most Manitobans get that message. Most Manitobans have been doing their part, and then once in a while you'll get people who maybe didn't get the message, maybe they don't quite understand how important this is, and then we have to resort to enforcement, and we will. This is important enough, so we will enforce when we need to.
Mm-hmm. And just a quick follow-up, but Mr. Siragusa, you were saying that the Brandon testing site was going to be moving. Could you comment briefly on why exactly the decision was made to move it?
Yeah, so most of the testing sites are not at an acute facility like a hospital. So they moved to a more community-based setting, which is typical for what we're doing. And I expect as the testing volumes change, they may go up, they may go down, and we will adjust and adapt as we need to as we go. So this was a decision made by Prairie Mountain Health and very much supported by Incident Command. So really just keeping community work community-based.
From CJOB, Diana.
Good afternoon, Diana from 680 CJOB. Just a question today on care homes. Given the tragic stories coming out of personal care homes in Ontario and Quebec, I'm wondering if all care homes here in Manitoba, both public and private, have all the PPE they require, and kind of whether or not employees are still allowed to work at different homes, or if regulations are being changed to kind of prevent them from going from different homes during their work.
Mm-hmm. So to my understanding, the long-term care, personal care homes do have the PPE that they require. If they don't, they should be escalating that because we know this is a high-risk population. So from that end, I think we're good. And we have also been working quite collaboratively with the private personal care homes as well. They've been good partners, and we've been sharing information in terms of standards and guidelines, so that continues. In terms of staff going back and forth, yeah, we realize that is that can be a risk, and our teams are working on that right now to determine how we can mitigate that risk and make sure that the services stay in place. So that's actively happening, and as soon as we have some recommendations, we will be happy to share those with you.
And just as a follow-up, are you able to say kind of what staffing levels are like in those care homes? Do you have a sense of whether or not people are reporting to work as normal, and the staffing levels are those required by regulations overseeing personal care homes in Manitoba?
Well, I haven't heard that there are staffing issues, so that doesn't mean it's not happening. It's just maybe that I haven't heard, so I can investigate that further. But yeah, the staffing, I mean, these are usually fairly stable people. This is their home. They have lower nurse-to-patient ratios than you would in a hospital, like health science center, obviously. So I think it can range depending on the needs of the patients. But it's definitely it's a lower healthcare provider to resident ratio. And I will check for you, Diana, if there's any staffing issues that are being raised, because I'm not aware of them.
All right, we have time for a few more questions. Any of our reporters online, go ahead, please.
Hey, Dr. Roussin, it's Bartley Keevis here at CBC again. There has been an increase in deliberate misinformation that we've seen. A so-called protest in Vancouver this weekend. You have said before about misinformation, but what efforts could the province take to actively counter misinformation? For example, even making misinformation subject to a public health order and some sort of form of active deterrence.
Yeah, well, I think that the credible information is really important, and misinformation can cause significant damage to our efforts going forward. So we've continually tried to get Manitobans to go to our website for credible information. We've had these daily briefings because we're getting a lot of credible information out through media with this. So I think that it's something to look at. If we keep seeing specific issues, then we'll definitely can look at ways to deal with that, whether it would come in the form of a public health order under the Act or not. But we do need to fight misinformation because it's certainly a barrier to a good response to the outbreak.
Hi, it's Carol at the Free Press. I just had a question about projections and modeling. Is that still something that's being considered? And if so, when might we see some projections for what Manitoba can expect in terms of COVID-19 cases?
We're actively working on that, and we hope to have that within the next, hopefully week or two, to be able to provide to Manitobans. So we have some numbers, we have a stable model, needs some working. These things will change. These things are only as good as the data that you put into them, and of course they are just predictions. They are possibilities, and so we hope to have some numbers out to Manitobans. But these numbers don't change the fact that our best way to limit the impact of this virus is our current strategies, the public health response, as well as practicing physical distancing at all times, staying home, and then hopefully we could even beat the projected numbers.
Again, we're from Winnipeg, son. Just wondering, when you do an inter-hospital transfer, are those patients that are transferred in between different, let's say HSC and Riverview or wherever, are those patients tested before they go into a new facility?
Not normally. It really depends on if they have symptoms, and it would only be when they have symptoms that we would test them. So depending on the circumstances of why they were transferred to a hospital and why they were transferred back.
Kelly Malone, the Canadian Press. Dr. Roussin, you had mentioned that you'd be enhancing the public health orders this week. Can you give us an idea of some of the measures that you might be looking for or the impact that they might have?
Yeah, well, I don't want to speak to specifics because we are working on it right now and drafting, and so we'll be able to announce those later in the week. But things like group size, we're currently looking at, and so more to come later on. I think that our efforts right now are being reflected in some of these numbers. And I think the real message is that we cannot let up. I think this is a critical time right now for Manitobans because they see some numbers that haven't been climbing. It's getting nicer out. People have been restricting themselves for a long time now. And so I think we're at a critical juncture where these next orders are going to continue to ensure the message gets out that we have to double our efforts right now, knowing that these type of restrictions aren't going to be in place forever. These type of restrictions, we're looking to roll them back as soon as possible.
Dr. Roussin, can you clarify, for the businesses that are critical, can staff still work inside those facilities as long as they're not seeing customers in person, like online and curbside pickup over the phone?
That's right. So if a business is operating right now, they're allowed to operate on their premises. If they're servicing customers online or curbside pickup or delivery.
Dr. Roussin, Bart McKeevis here. Just minutes ago, given a tip about a paramedic in the Southern Health region testing positive. Do you have any information about that?
No, I haven't been briefed on any such thing.
Okay, thanks. May I ask one more? Go ahead.
Marty Blunt with Global News. We just wanted to follow up on the PPE supply. We're hearing concerns from some frontline healthcare workers about being assured that there is a good supply of PPE. When then they're also hearing that that's not the case. How do you address just the concerns over mixed messaging on this issue?
Well, not knowing where that person is located and what area of work they are in, I would ask them to talk to their manager about that. We did hear about it over the weekend. We talked to senior administration just to make sure that it was, if it's in the region, how does it get out to the people? So I can't speak to the specifics without knowing where they are or what PPE they need. But I know that PPE's been flowing out and been delivered to different regions. So if it's a specific type or a specific place that there's a gap, we certainly would want to hear about that.
Dr. Roussin, Bart McKeevis at CBC. How many total cases and deaths of influenza were there this flu season, just for comparison's sake, to your knowledge?
All right. So the flu deaths, I believe this year we were at 26. The last time I looked, it was they stopped putting the report out. But haven't checked those numbers recently because they've stopped putting the report out on that. But I believe it was 26 deaths this year that we saw.
Thank you. Scott Bill from the Sun here. Just to follow up on that, are the flu numbers going to be skewed this year, just given the orders? Stay home if you're sick and that sort of thing, so people just aren't maybe presenting as much with the flu, and those numbers are affected by it?
Well, we've seen already the downtrend of the flu just as this pandemic was starting to hit us. But certainly respiratory infections like the flu, like coronavirus, are spread in much the same manner. So the protections that we put in place for coronavirus would help with the flu as well. Washing your hands is the big thing, staying home when you're sick. So I would expect this to help with any kind of respiratory viruses.
Dr. Roussin, Diana from 680 CJOB here. Just a quick question. I don't know if I completely missed this, but you mentioned possibly doubling down on these measures. What could that look like if you are indeed to tighten those restrictions later in the week?
Yeah, so it's something that we're working on right now. I don't want to put anything out there that hasn't been finalized yet. So we're looking at all aspects of the order and hopefully can have something in place this week sometime. But I don't want to speak on specifics until we have that nailed down.
One last one, if you've got time. Are you? Is Manitoba? But to keep it serious, is Manitoba using any the contact tracing apps that Quebec and Ontario has ordered or commissioned?
We don't have any apps in place at this time. We're looking at all those type of things. We do have a public health call center that we're utilizing right now to be able to contact cases daily as well as their close contacts daily. So that's what we're utilizing now. But as as things progress, we'll be looking at other type of technology as well.
And that concludes today's media briefing. Thank you.
Thank you.
Thanks.